underneath, a sure death, another patient sees Dr. Montaner or whatever else. At a time in which I was telling the paper we were making terrific progress in our fight against HIV. It's been hard, it's been difficult, but I am thankful for the support that we have gotten from you, from ECPWA, to do the work that was needed to make a difference. In addition to that, I think we need to pay some homage to the Sisters of Providence, because without them stepping in and saying, yes, we're going to commit to this fight, there would have been no St. Paul's, there would have been no AIDS program, and we would have been just like BGH or the UBC hospital at the time. You are on your own, and God save you. And thanks to them, we step up to the plate, and actually we put the resources that were needed so that we were there for you and you were there for us. Things continue to be difficult. I'll skip a couple of decades because of a matter of time, I could go forever to tell you. But things continue to be difficult. And let me tell you, we in British Columbia, we are fortunate, we are extremely fortunate that we have had the most generous medical program in the whole country. Many of you don't realize how fortunate we have been. HIV treatment in this province never had co-payments, deductibles, or any other barriers to care. Every single service, medical service that you need, for the most part, and I recognize that they were not perfect, are paid in full. And this is true, and it has been true, no matter who was in Victoria. We've been very fortunate that the most recent Liberal government has been extremely and particularly helpful. I have to tell you that over the last decade, we've been able to work with the government in Victoria to expand antiretroviral therapy programs at a time in which every other health program in the province was actually being contracted. And the reason for that is because working with you through the BC Center, we have been able to show convincingly that by bringing more and better treatment, better support and better outreach to people infected with HIV, we are actually better able to decrease morbidity, decrease mortality, but in addition to that, decrease HIV transmission. You heard today that we have virtually eliminated mother-to-child transmission of HIV in the province of British Columbia. This is a testament to the fact that our treatment is not treatment, but it's also treatment and prevention. And it's actually the most effective preventive tool that we have. Today, a woman infected with HIV will be told, for the first time in 3 decades, yes, you have a problem, we will actually help you, you will have a normal reproductive life, you will have a child, you will put your child through university, and you will be there to see your grandchildren. And in addition to that, let me be very clear, gay men today can have a normalized life, a normalized sexual life, because we all enjoy our sexual life, and they do too, because of antiretroviral therapy. And that should not be a shame. Actually, we should be proud of that, because that actually makes their life normal. They allow them to be proud of what they are and lead a normal life in society. And whether we like it or not, the same is true for injection drug users, because we have shown that we can decrease 90% the risk of HIV transmission by treating people who have HIV who are injection drug users. And I'm not recommending that people start using drugs, but I'm telling you that bringing treatment to people who use drugs is an essential way to do the best for them and the best for society. And although you may think that this is actually now clear to everybody, let me tell you, it is not clear to a number of people, including Stephen Harper. So you have responsibility, and I know to tell you how to cast your vote, but you have a responsibility to do the right thing and to bring your friends, family, and everybody you can to vote next month, because if we don't, we're in for a deep, deep trouble. In the last month, I was actually surprised when the CDC, the Center for Disease Control in China of all places, after working with us for a year, surprised me by making an announcement that they are going to embrace at a national level, this is a communist country I'm talking about, at a national level, the C-country program that we have proposed in British Columbia for the whole of China. And to show you that I have no allegiances to the right or the left or the center or anything else, I am invited now by the Vatican to come and discuss C-country, the single strategy with the Vatican, because even the Pope gets it. So why the hell does Stephen Harper doesn't get it? Let me leave you with one piece of data. This is unpublished data that will be coming out very soon. First, the supervasation site reduces mortality from overdose by 35%. We will be publishing this in the Lancet in a week. Please keep it to yourself. This is confidential. But when it comes out, Stephen Harper is going to have a nightmare. The second piece of news is that British Columbia is the only jurisdiction in the whole country that has seen decreasing rates of HIV new diagnosis since 1996 steadily. Neither Ontario, nor Quebec, nor the Prairies, nor the Atlantic region, no region in this country has seen any decrease in HIV. We need to do it for this country, or without British Columbia, and we can't do the right thing when you go to vote. Thank you.